We are live streaming spine surgery from Deuk Spine Institute. This morning, our patient travels from Canada, from actually Alberta, Canada. He's had a 20-year history of back pain. His lower back pain has been incapacitating. He's spoken to other surgeons who are telling him he needs invasive surgery, laminectomy, fusion. Did not want it. He had the video conference with my team and chose to perform our signature proprietary treatment called the Deuk laser disc repair. He is here to have the Deuk laser disc repair, L4-5, L5-S1. When I examined him, I noted that he also has some facet joint pain, L4-5, L5-S1 as well. So we're going to be treating that today after the laser surgery on the disc. First thing I have to do is get into that L5-S1 disc, which is not an easy thing to do. You can see there's a lot of arthritis with enlargement of bone. I'm going to do my best. Yeah, thank you, Jordan. And hopefully we'll get there. Sean? All right. If you have questions, feel free to ask. AP? I'm going to use the X-ray machine to navigate. If there's no questions, Henry, let's start by showing the audience how the Deuk laser disc, or how disc injuries like a degenerated disc or a herniated disc can be so painful. What causes that pain?
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from our video that the number one cause of back pain, chronic back pain lasting more than 2 weeks, is an annular tear that gets inflamed, lots of inflammation due to the herniation. This patient has some other anatomical abnormalities I'm going to show you. He has congenital stenosis, which means he has short pedicles. Show us the pedicle right there. Yep, very short. Should be about twice as long as that. What that means is that in most of his life he won't even know this, but when he gets older and he gets some herniated discs, they start to pinch the nerves coming out the foramen much easier, much quicker, much sooner, because he doesn't have much room in there to begin with. So we call that congenital stenosis because he's born with it. That's the congenital part. On top of that, he's got acquired stenosis, which means he acquired it during his lifetime. That happens from herniations, facet enlargement, ligamentous buckling and enlargement. But we're going to be going in and fixing only thing that needs to be fixed today, which is the herniation and degeneration. Sean, any questions? Feel free to ask.
At this moment, no current questions.
Let's go ahead and show the audience then how we're going to use the Deuk laser disc repair, AP, to perform a surgery that eliminates back pain from the discs as well as leg symptoms from the disc.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You see from our video that the laser procedure is done with an endoscope where I can go inside the annular tear, find the herniation, find the inflammatory tissue, find the bone spurs, and remove bone spur, herniation, inflammatory tissue out of the tear. That will allow his body to heal the disc properly. Right now, his body wants to heal that tear, but it can't because the herniation is blocking it. The herniation of the nucleus sits there in the tear, blocking the tear from healing. At this point, we're going to get started with our discogram. We do what's called an evocative discogram on the patient, where we, what is that, 102? Yeah. Where we basically want to find out, is this disc painful? Is this what's causing your typical pain? Now, I already know the disc is causing his pain because of my experience of treating patients, so I can identify the pain source by the physical exam and MRI. However, it's always good to verify it when you can with a test. Are we ready?
Are you having any back pain, sir? Any back pain? Yes or no? You're having a little on the left side? He's having a little pain on the left side.
Can you guys see the 20 years of back pain?
Yes, we can.
So, when I asked him, where is your back pain, he pointed to this area right here. Okay. Are you having any back pain right now?
Any pain, sir?
A little on the left. All right. Not too bad? How bad is that right there on a scale of 1 to 10? What's the highest?
What's the number? 8.
Did it go over an 8? Did it go over an 8?
He said he is
All right. Scale of 1 to 10, what's the highest? All right. Well, I just finished testing your discs. Both of them are causing your typical pain. Is that where you get your pain normally?
Yes.
When you wake up, that pain will be gone for the rest of your life. You can have a normal life. How does that sound?
Good.
I want you to count from 1 to 100 out loud for me. Start counting. Keep going. Keep going. I want you to count in Canadian. All right, folks. For those of you watching, we're done with our evocative discogram. I just confirmed that the L4-5 is severe pain, 10 out of 10, concordant, meaning it's his typical back pain he gets every day. And then at the L5-S1, it is 8 out of 10, and it's concordant. So both discs, 4-5-5-1, you can see on the MRI they're degenerated, and both discs are causing his typical back pain. Remember, the disc injuries like degenerative disc disease, herniated disc, bulging disc, ruptured disc, extruded disc, protruded disc, slip disc, spondylitic disc, all those names are the same thing. It's a disc injury, and the cause of the pain is the same in all of them. It's a posterior annular tear inflammation. That is what I discovered 20 years ago. Dr. Deukmedjian, the founder of Deuk Spine. I've been treating it for 20 years successfully. Our success rate of getting rid of back pain from the disc is 99.6%. That's patient-reported outcomes. That is the average. That is over 500 patients that have had the surgery. We have now done the surgery with the laser on the back, the neck, and the thoracic in 2,745.
47. 47.
This will be 47, right?
Correct.
Yeah. So we've done in 2,746 patients. This will be 47. So this is the number of DLDR. Are you ready, Dr. B?
Yes, I am.
Let's go. going to place the dilator. We're going to L4-5 first. That was the more painful disc shot. I'm going to enter the tear right now. Remember, what hurts at L4-5 is not the entire disc. Is he okay? It is just the posterior annulus. Come on, Jordan. You're going to see this dilator go into the tear. That tear is what we're targeting. We're not interested in the disc itself. We're interested in just the tear in the back, where the pain comes from, where the herniation lives. Wait, shot. All right, good. Taking the guide wire out, putting the dilator in. At this point, our dilator has passed through the posterior annular tear, where the pain is coming from, as discovered by myself. And now we're going to put the tube down over the dilator. We're going to use the tube to perform the surgery. The tube itself is 7 millimeters. And the tube, the dilator, the guide wire, needle do no damage internally. The only damage we're doing is the skin incision, 1/4 inch. So we've shown the audience, Henry, how a disc injury causes chronic back pain.
Correct.
And we've shown the audience how we fix it with the laser.
Correct.
Later today, folks, we'll be doing a very complicated surgery. A patient who in 2015 underwent a cervical laminectomy without stabilization, which is a big no-no. And the patient has since developed a chin-on-chest deformity where he can't pick his head up. He's looking down at his feet all the time in constant pain. He's been that way for 4 or 5 years now. Found us, recognized that the Deuk Spine Institute doesn't just do laser surgery. We also do conventional surgeries. And he recognized that we're one of the best in the world at doing fusions, laminectomies, discectomy, etc. So he came here. We'll be doing his surgery next. It'll be a very complex surgery. It's going to take about 2.5 hours to do the whole surgery. That will be next. Posterior cervical laminectomy, osteotomy, correction of deformity, instrumented fusion. Any questions?
At this moment, no current questions.
Fine. We're in the L4-5 disc. We're within the tear. What we're seeing here is fragments of herniated disc stuck inside the tear. Now, these fragments have a name. They're called nucleus pulposus. Nucleus pulposus is not supposed to be found within the annular tear. It is supposed to be found in the center of the disc, where it lives. When it's healthy and normal in the center of the disc, the nucleus pulposus is pure white, a white color. We saw that in our last laser surgery. If you go back to our YouTube channel, you can watch the last lumbar laser surgery I did, and you can see normal nucleus in the middle of the disc. I left it alone. It does not stain blue. Anything that stains blue is abnormal. We use our special blue dye to stain structures like the degenerated nucleus pulposus. If you want to know what we got down here, we have end plates of the vertebral body, which do not stain blue. We have bone spurs, which do not stain blue. We have scar tissue, which does not stain blue. All of those are white. We have calcium deposits right there, which don't stain blue. They stay kind of a orangey beige color. We have normal nucleus, which is white, does not stain blue. And then, of course, we have the herniation that is degenerated, and that does stain blue, like right there. Let's have a grabber. Somebody asked me the other day, Dr. Deuk, you only use the laser, you don't use forceps. Nope, I use forceps too when it's necessary. There's a piece of herniation. Look at that. Here it comes. She's a beaut. So that thing was stuck within the annular tear, causing pain, like a thorn sticking in your foot. Got to get the thorn out to get rid of the pain. Okay? It's no different with a herniated disc or a bulging disc. As long as you have a bulging disc, the disc will never heal. Your disc will only heal if you have this procedure, the Deuk laser disc repair. It's the only procedure in the world that will allow your disc to heal. Any other procedure done will be copying my procedure that I pioneered 20 years ago. So doctors are going to start copying our procedure because they're seeing the success that we have at curing back pain and neck pain. But they will never be the original. There's the tear right there. You guys see it? At 12 o'clock.
Yes, we do.
Pretty obvious as I move my tube that is the tear. Any questions?
Yes, we have 2 questions. This one is coming from Patricia on Facebook,
Well, Patricia, hi there.
asking, is knee pain / swelling associated with L4-5-S1 issues with spondylolisthesis and spinal stenosis? Knees seem swollen and was told it was osteoarthritis and needed knee replacement. Balance issues, tingling in the front of shins and groin to leg pain. Is this part of the stenosis?
That's a great question, Patricia. Thank you for joining and asking. The answer is that the knee pain and knee swelling is not part of pinched nerve or spinal stenosis. Has nothing to do with your back. You have degenerative joint disease in your knee. You do not need a knee replacement. Deuk Spine Institute is now doing what's called the knee Deuk plasma rhizotomy. It is a minimally invasive, advanced, new treatment that there is no open surgery. You don't need metal put in. I go in with this exact a 4mm incision, and I destroy your pain nerves that are causing all the pain. It takes about 15 minutes. It's done under twilight sedation. And Henry will put, or Anthony will put a link into the dialog box to a Deuk plasma rhizotomy animation video so you can see what it is that I'm talking about. That is a service we offer. If you're interested, just do the MRI review we have on our website. It's currently for spine, but we can also do for joint. You just let them know it's knee pain and send us your x-ray or MRI or CAT scan that you have of your knee. That said, you are complaining about groin pain as well. Now that itself, the groin pain and thigh numbness, could be more related to pinched nerves in your back. I would have to really do an examination, which I can do during our Zoom call. But don't get a knee replacement without first trying our minimally invasive Deuk plasma rhizotomy. With our procedures, we have you back on your feet within an hour of your surgery, okay? Leaving our center, and the next day you can go back to doing normal stuff. There's no restrictions. It will be the future of knee replacement surgery. My procedure, it's patented and it's FDA approved, but other doctors are not recommending it because it's not yet covered by insurance. So they don't want to take a pay cut. They want to recommend invasive surgery because that pays the surgeon more money. But it's dangerous for patients. Knee replacement is a risky procedure. There's lots of complications. With our procedure, we've had no complications, and it's 80% success at keeping people from getting a knee replacement, which means if you get it done, the Deuk plasma rhizotomy, then there's an 80% chance you're not going to need anything else done. There's a 20% chance it won't work. And I can usually tell who it's going to work for by doing a little Zoom call. Thanks for asking. You said there's a second question.
Yes, next one from Lanu on YouTube.
Hi, Lanu.
Asking, in Siberia, there are people taking cold baths outdoors with negative 75 degrees Fahrenheit. They said it strengthens the immune system. Is this true?
Well, that's a great question. I have to say I don't know enough about it to tell you if it's true or not. But I can I can say that if you do one cold bath, it probably will not have any type of a long-term effect on your immune system. I will tell you also that if you do one cold bath, it will cause what's called a cortisol release, a stress release of cortisol. And cortisol actually suppresses your immune system. But cortisol does reduce inflammation. So that cold bath could reduce inflammation, but I don't think it's going to help your immune system. I think in my experience and knowledge of what I have of the immune system, I would say no. It's not going to bolster your immune system, okay? Right? But I think it will reduce your inflammation in your body. I think it's a natural way to reduce inflammation. You guys see the pink stuff right there in the tear?
Yes, we do.
That is inflammation. That's at 11 o'clock right up there. That's what's causing his back pain. Now, if he did a cold bath in Siberia at negative 75 Fahrenheit, he would probably get some temporary inflammation relief. But he may actually get eaten by a polar bear too. I'm sure there's no polar bears in Siberia. Maybe there are. Huh? Are there? Are there polar bears? They wear little red hats. Funny. Funny. All right, great question. Any other questions or comments?
No current questions. We do have a comment from Patricia on Facebook saying thank you.
You're welcome. Anything I can do to help you. That's why we do these live streams, Patricia. Doctors just don't have enough time these days to spend with patients to answer all their questions, and many doctors don't even know the answers to all the questions. And the other thing I found is doctors these days want to recommend treatments that the insurance company is going to pay for rather than what's best for the patient. It's crazy. I never thought I'd see this day. I grew up in a medical family. My dad was a doctor in California. And honestly, I just see doctors all over the United States giving people recommendation for treatment that is covered by insurance but is not the right treatment for the patient's condition. And we got to stop doing that, because what the insurance wants to pay for is not what's best for the patient. Not every time, and not even half the time. So you patients need to be aware that there are better treatments out there your doctor is not recommending, because they don't want to get in trouble with the insurance company for recommending a treatment for you that the insurance company won't approve. I, on the other hand, went into medicine not to help the insurance companies be rich. I went into medicine to do what's best for the patients that I treat. So my recommendations are always what's best for the patient, not what's best for the insurance company. People should always have a choice. If they want to do what the insurance company wants them to do, then they should be able to do that. If they want to do what's best for them and not covered by the insurance, they should be able to do that too. But honestly, in the end, the insurance should really be paying for what's best for the patient. That's how medicine started hundreds of years ago. When insurance started, that's what insurance did. They paid for what the doctor recommended. And now, over the last 40 years, the insurance companies have figured out that they can actually save money by not paying for the newest and best treatments, because everybody wants those better treatments, whereas people who are offered a worse treatment usually won't take it. You know, a treatment with bad results, like spinal fusion. They're not going to take it. So they don't spend the insurance company's money as readily when they're offered a limited number of treatments, for example, spinal fusion. This patient was recommended for spinal fusion. He didn't want it. He wanted something better. He's an athlete. I can't tell you what kind of athlete he is. I don't want to give you away any information about who he is, but was a professional type athlete, professional level. If you know that he's Canadian, you might be able to guess what he did, but he knew he didn't want fusion done. He was a smart man. He came to Deuk Spine. He's not going to need a fusion. All right, there is the end of the tear. We're now outside the tear right here, looking at the last of this herniation and removing it with a laser. Just for reference, that fiber you're looking at, the glass fiber, is 1 millimeter wide, 1 millimeter. So it's very tiny. The endoscope gives us a great view inside the disc, inside the tear of the disc, so I can clean it out. And that's what I've done. That tear is completely cleaned out. Everything okay over there? Who's over there? All right. You need some help? All right. Did I see Nikki in here? Yeah. Nikki. Nikki, you're here. Are you? What? Why didn't anybody tell me? Huh? I had no idea it was your birthday. Happy birthday, Nikki. And you chose to spend your birthday at Deuk Spine in the operating room. Thank you. Well, I mean, it's what I would expect from Nikki. She's a professional. Professionals remain professional. That's called professionalism. Glad to have you here, Nikki. Are we going to be putting you through the spanking machine? Yes, maybe. But it'll be a sterile spanking machine. There was some more inflammatory. You guys see that inflammatory tissue that was right there? Guess what that is? That's the facet joint. So that was inflammatory tissue on the facet joint coming off the facet capsule. We don't see that very often. As a matter of fact, I've rarely ever seen that. But if you rewind and go back, you'll see it. I just zapped away inflammatory tissue from his facet joint at L4-5. Now that was anterior in the joint, very far anterior. Wouldn't be able to get to it from the back. The only way to see that is transforaminal. I've got about 30 seconds left on 4-5, and then I'm going to move to 5-1. Any other questions on this one?
No current questions, but we do have a comment from David on Facebook.
David, welcome.
Saying, I have a Zoom meeting with you tomorrow. Hope to God you can help me. Talk to you tomorrow morning. God bless you.
God bless you, David. Thank you for joining us. And David, I just want to say I'm proud of you for doing your homework and watching the videos. I did some telemeds video conferences on Wednesday, and a lot of the people I talked to on Wednesday really had never watched any of our surgeries. They had no idea what we do. They were just looking for a free neurosurgical appointment to ask questions, but really didn't do their homework. And those kind of people, unfortunately, in my expectation, is they're not going to benefit as much as somebody like you, who does your homework and learns about what we're doing and why it's better than anything else out there. So congratulations to you, kudos to you, and happy birthday to Nikki. David, be sure to wish Nikki a happy birthday tomorrow. She'll be doing your MRI review with me. So you must be completely ready for tomorrow if you're here. All right. Nikki says she'll send out emails for our Zoom calls tomorrow once she's done here. Okay, next disc is L5-S1, the bottom, the hardest to get to. Here we go. I'm going to take the needle out, and I'm going to place over the guide wire this dilator. For those of you who have never seen it, you guys see this? This thing is tapered. It has a very tiny, look at this thing. That's an inch from there to there. This is, I don't even know what that is, 1/16 of an inch. So it's very narrow, slides down the guide wire. Why is that important? Because what this thing does, okay, it actually spreads the tissues open as it goes down. It doesn't cut anything. Shot, we're not cutting. That's why we take a shot. We're not cutting anything, we're just spreading. All right, so looks like we got a little schmutz in there. Shot. I'm going to have to just be careful as I advance. Shot. Shot. We're going to be taking a lot of shots because it's trapping the guide wire with a little schmutzaloni. That's just some soft tissue in there like disc material. We're going to have to clean this out real good, guys and gals. All right, I will advance the dilator through the foramen at 5-1 on the left, get into the annular tear, and be right as rain. Yeah. I'm going to pull back this guide wire just another couple of millimeters, and we're going to head in. Any questions?
At this moment, no current questions.
All right. Why don't we do this, Henry? Let's share with the audience the 30 different causes of back pain. What? Wait. While we get into this disc and get it ready. I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4 and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us. All right, welcome back. We just showed you guys a video that explains the 30 different causes of chronic back pain. Those 30 causes were discovered here at Deuk Spine, put together by Deuk Spine Institute, so people could know what those causes are. Many people go to the doctor, say, I have back pain. The doctor says, I don't know what's causing it. Well, now you can learn yourself from our website, the 30 causes of back pain. But you can't diagnose yourself. So don't think just because you know the 30 causes, you're able to diagnose yourself. The diagnosis of back pain requires a doctor, like me, a trained diagnostician who can figure out where your pain's coming from. Because MRIs will never tell you, X-rays will never tell you. There's no test in the world that tells you what causes your back pain except a doctor who knows what they're doing. And that's what Deuk Spine Institute has. We have a doctor who does. All right, take a look at this L5-S1 disc. You see that gap right there? That is the end plate. That on the right side is the S1 end plate, and on the left is the L5 end plate. And there's supposed to be a disc in there, but there's no disc. His disc is completely degenerated. He's had back pain for 20 years. If he would have come here at Deuk Spine Institute when he first started having back pain 20 years ago, I would have done this surgery, cleaned out this area, and that disc would still be there. Because what destroys the disc and causes degenerative disc disease is actually inflammation. By getting rid of the herniation stuck in the inflamed tear, I would get rid of his inflammation, and I would then be able to preserve his disc. All right, so the message here is come to Deuk Spine Institute early, get your back fixed early, don't wait years, get it done early so you don't lose your disc. It doesn't degenerate. It's the inflammation that causes the degeneration. Any questions?
Yes, we have a question from Lanu once more on YouTube.
Hi, Lanu.
Asking, L5 to S1 is always hard to reach. Is there another way to get it?
Yeah. All right, so Lanu is asking, is there another way to get to L5-S1? There is another way, but it's not a good way. It's a bad way, okay? A very bad way. And I don't recommend it. We're done here, though, with L5-S1. The other way to get there is translaminar. I don't recommend translaminar.
Two on, please. Stop on.
All right, translaminar is another way. They also say interlaminar, between the lamina, but it doesn't give you the transforaminal view and the transforaminal exposure you need to do the surgery properly. I don't do that way because it's not necessary and it's harmful to the patient because you have to remove normal bone, normal ligament to get there. All right, thanks for joining us. We're going to be back in just a minute with our Deuk plasma rhizotomy for the facet joints. The entire DLDR surgery was done through a 7mm tube, and the incision is here. It's about 7 millimeters wide. And this patient's going to go home in an hour. Home in an hour. When he wakes up tomorrow, that pain he had before won't be there. Isn't that wonderful? Thanks for joining us.